Well, to conclude on this antihypertensive chapter and these major drugs that are so often used in our patients, we have built up a table about what drug would be more relevant in certain comorbid conditions. In other words, comorbid condition if you have hypertension and something else. Well, it's pretty straightforward. If you had hypertension and angina, common combination of pathologies, beta blockers and calcium channel blockers should come to mind. They work for both hypertension and angina, improving survival, particularly of patients with risk of MI, such as beta blockers. Certainly, if you have diabetes or heart failure, don't forget the use of ACE inhibitors and sartan type of drug, angiotensin receptor blockers. Post-MI, no doubt beta blockers out of the series should come to mind if you also had hypertension, since they've been shown repeatedly in clinical trials to improve survival. With BPH and hypertension, you remember the use of alpha blockers. And if you have hyperlipidemias and hypertension, maybe the easiest would be to say what to try and avoid. And remember that in hyperlipidemias, certainly beta blockers would not be a great choice, being that they can cause hyperlipidemias. That's why in this table we tell you alpha blockers, calcium channel blockers, ACE inhibitors, angiotensin receptor blockers, all have in common not to mess up lipid profiles. By the way, thiazides, which are also commonly used in hypertension, thiazides will also be shown to you later on as increasing lipids in the blood. So I wouldn't mind you to know right from now on that as far as hyperlipidemias and hypertension go, there are two classes of drugs to try and avoid, the beta blockers and the thiazides.